What is one of the atypical signs of heart problems in male that we don't pay attention to? Today, it's going to surprise you that erectile dysfunction may be your heart's first warning sign if you are a man. So pay attention to this video because men could have heart disease and their warning sign is not always you having a chest pain. It is erectile dysfunction. In fact, this may surprise you that as a practicing hospital internal medicine doctor and sometimes doing telemedicine, I've seen countless of men coming with erectile dysfunction. This is not something to be embarrassed about because it could just be a subtle warning that your body is telling you that your heart is in trouble. In fact, I have evaluated hundreds of men with erectile dysfunction only to find out that they have problems like high blood pressure, high cholesterol, diabetes that are undiagnosed, and sometimes even heart disease that they never were aware of, and their only presenting symptoms was erectile dysfunction. Now, as you know, erectile dysfunction is not always a sexual problem, okay? It could be just a vessel problem that your blood vessel has important problems. So, on today's episode, I'm going to explain to you why erectile dysfunction could be an early warning sign of vessel problems or even heart problems in male. And number two, at what age you should take this very seriously. Number three, which men are the highest risk. And then, of course, number four, the most importantly, what you should do if you're experiencing an erectile dysfunction in this age group. Now, first of all, let's define what is erectile dysfunction and what erectile dysfunction is not, because a lot of men, especially the younger population, have a lot of misunderstanding about erectile dysfunction. And the simple definition is that you are unable to achieve, or is the inability for a man to achieve or maintain erection during sexual intercourse to satisfactorily complete a sexual activity. So it is the inability for men, all right, either to achieve, to maintain, or to be able to achieve a hard erection enough for you to complete satisfactory your sexual activity. And it is very important to understand that occasionally men could have things like that, especially if they are under severe stress, they are fatigued, lack of sleep, sleep deprivation, or if they are drinking a lot of alcohol or you have a temporal illness, you could temporarily have the inability to obtain or to maintain erection. And if that is occasional, it is not erectile dysfunction. And this is very important because some men may have psychological erectile dysfunction, and so they'll go for medications and stuff like that. But that is not what we're talking about today. What I'm concerned about today is if you have persistent, recurring erectile dysfunction, especially if this develop gradually over time, then you should pay attention to it because many men, when this happened to us, we said, oh, I'm just getting older and this is part of the aging process. Yes, while the aging process does increase the risk of erectile dysfunction, persistent ED, which I'm going to shorten it, erectile dysfunction, persistent ED should never simply be dismissed without considering underlying causes or seeing a physician to work up what could be the risk factor causing that. Okay. Now, in the first place, let's talk about why ED can be a first sign of heart disease. Okay. Now, we men, we achieve erection when there is a healthy blood flow through the arteries that go through the penis. Okay. That is when we achieve erection. So when we are sexually stimulated, our blood vessel relaxes and allow more blood to flow through the pineal arteries, and therefore we get an erection to be able to initiate a sexual intercourse and to complete it. Okay. Now, if those blood vessels are very narrowed by plaques, what we call atherosclerosis, it will reduce the flow of blood through the spinal arteries and therefore causing what we call erectile dysfunction. Now, one significant thing you should know, a key point, is that the arteries that goes to the penis are smaller in size, in diameter, than the arteries that goes to the heart. So because of that, for example, the arteries in the penis, the size is about 1 to 2 millimeter in diameter, whilst the arteries that goes to the heart, their size about 3 to 4 millimeter in diameter. So they are slightly larger, to twice larger than the arteries that go to your penis. And so if you start having decreased blood flow through your arteries going to your penis, it's a warning sign that this may be happening to your heart, but slowly, okay? And so your penis arteries are smaller, so they become blocked earlier enough to cause these symptoms years before the coronary arteries do. That is why erectile dysfunction, it could be a warning sign that will appear sometimes 2 to 5 years earlier before a heart attack, a stroke, or a diagnosis of coronary artery disease. This is a very important anatomy that you should not forget, okay? So think of erectile dysfunction as a potential warning light on your dashboard telling you that, hello, it is time to check your heart. And it's just your body telling you that it's time to check your heart, and don't just take medication to mask the symptoms. Now, at what age should we pay attention? At what age? Now, I'm going to define these ages from ages and men under 40 years old, and men between 40 and 60 years old, and men after 60 years old. Now, men under 40 years old, if you have a persistent ED, you deserve a careful evaluation. Despite certain psychological factors that can certainly play a role, you should make sure you go in and get checked for things like diabetes, high blood pressure, high cholesterol. If you're smoking, you should quit smoking, either hormonal disorders or obesity. So if you're men under 40 years old, these are the things that you should check for if you start having signs of erectile dysfunction. Now, men between 40 to 60 years old, this is a group that we most strongly link to cardiovascular disease. This 40 to 60 years old, ED is strongly linked to cardiovascular disease. Now, if you are in this age group and you develop erectile dysfunction, don't just take a prescription for it because you may be having a very, very serious warning sign that you may be having a heart problems. Now, what about men after the age of 60? Well, it becomes very, very common. ED becomes very common when people are aging, but it's still important to just remember that you are not just getting old. You may be having underlying vascular issues, and you should make sure that you get evaluated. In fact, men in this age group also, if you're taking a lot of medications, make sure that your physician review the medications for you, and to ensure that there isn't medication interaction also linking to the erectile dysfunction. Now, what risk factors should you not ignore? This is very important. If you have the following risk factors, then if you're having ED symptoms, you should get checked immediately. Risk factors like high blood pressure, diabetes, high cholesterol, smoking history, if you're obese, if you have sleep apnea, that's a big risk factor, kidney disease. These are risk factors that if you have, including family history of heart disease, and also if you're somebody who lives a very sedentary lifestyle, physical inactivity, and you're experiencing ED, you should make sure that you go in and get checked immediately. Now, what should we do if you are a man in this age category and you're experiencing, erectile dysfunction, which has developed gradually over time? As I said before, you must make sure that you do a simple blood work. The simple blood work that you can do, talking to your medical provider to check. Number one, check your blood pressure. Make sure that it is less than 140/90. If you have no risk factors. If you have risk factors like diabetes, high cholesterol, make sure that your blood pressure is around 120/80. Okay, it's not more than that. And also make sure you check your cholesterol. We call it fasting lipid panel. Check your hemoglobin A1C, which will show you whether you have diabetes or not. Check your kidneys, check your testosterone level if you have decreased libido, that you have no sexual desire, and then you might check your testosterone level if there is no stress. And like I said before, also make sure that you review medications if you are taking several medication. So overall, there must be the assessment of your cardiovascular risk has to be assessed, because um, early evaluation will save your life. So, what is the take home message that I want to leave to you tonight or this afternoon, depending on wherever you're watching this video? If you are in the age group where you are experiencing ED, don't just take medication to fix your sexual problem, but look at the root cause that we've talked about, because it could be a warning sign that your heart is talking to you, that you may be having a cardiovascular problem. Now, if this video has been very helpful to you, I want you to subscribe to the channel, give us a like, and also in a comment, did you know before watching this video that erectile dysfunction in male could be a sign of cardiovascular disease? Leave us comment in this video and share this video with other men who are experiencing ED, because this will save their lives so they don't end up having a heart attack in the emergency room. And so I want you to come back here regularly to also learn very important medical tips to help you and I live very healthy. Until then, this is Dr. Moses.